Hi everyone, and welcome back to the channel. Today, we are honored to have another virtual assistant specializing medical billing, accounts receivable, and revenue cycle management. To introduce her, she graduated from Notre Dame of Marbel University with a bachelor's degree in clinical laboratory science or medical technology. Her first job was being a medical technologist in a hospital in 2022, then as a medical billing specialist for Genesis Health Group for 5 years. Hi, Miss DVK Arorong. Please welcome everyone. So, knowing that medical coding and billing are highly in demand in healthcare, your expertise will be incredibly valuable to our aspiring healthcare virtual assistant. So, first, Miss Divee, please tell us something outside of your professional life, maybe about your family, passion, or hobby.
Okay, ma'am. I would like to introduce myself. My name is Divee. I've been in the medical industry for more than 3 years, and I'm I'm not married yet. I don't have any kids, but I'm living with my partner, soon to be my husband. And so far, I'm busy with preparing with our upcoming wedding this
Wow,
year.
congratulations.
Yes, I do love cooking after work or before going to work. And we also do traveling on
Wow.
weekends.
Wow. Thank
Just
you.
a small trips,
Wow, awesome. Thank you
short
for
trips.
sharing. You're in Davao,
Yes.
correct, Miss Davy?
No, ma'am.
Ah,
We're from Cotabato province.
Cotabato. Okay. So let's start with the first question. Can you describe your experience with different medical billing software and electronic healthcare systems? Which ones are you most proficient in?
Um, I am knowledgeable with Tabor Choreo, also Office Ally, and Athena Health, but mostly I am well versed or well knowledge in using Office Ally and Athena Health because it is where my clinic or the facility, we are a network of facility, so we do use Athena Health.
Mhm. Thank you for sharing.
Mm-hmm,
I was just remembering how I was also navigating the billing system with my neurologist, and
mm-hmm,
I was just assigned to charge patients when he forwards me the credit card. And
mm-hmm.
like I have tried being interviewed for a BPO, and they told me that it's already medical biller 3. So, I really don't have medical billing certification or that complex experience, but medical biller 3 already. So, I was thinking of, shall I call myself a medical billing
Medical
specialist
billing.
already? Because
Is you
I
were doing one of the tasks or the roles.
Yeah, but the end-to-end part, that part I don't know, like accounts receivables and the
Mm-hmm.
claims that I need to be more knowledgeable about. So I'm happy that you're here so you can tell us more about it. Number two question. Can you walk us through your process for handling a denied claim? What steps do you take from the initial denial to resolution? So let me just review also. Accounts receivable. So these are the patient who has um outstanding balances or responsibility with us that we need to
Mm-hmm.
collect, correct? We need to call, email.
Yes.
Okay. So yes, please tell us more about denied claim. How do you handle them?
First, we should determine what's the reason for the denial codes, or there's a further, we should determine further denial so that you could um, act specifically or do the specific actions or appeal or considerations with that denied claim. And as well as if you determine the reason for the denial, you will know what are the documents you want to, you will be finding out or downloaded to appeal for that reconsideration or for that denied claims.
Mm. I just thought about asking because I also interviewed a medical biller from Pakistan, and he is
Mhm,
actually a teacher. So he was just able to expose himself to billing rules, and
mhm.
yeah, he loved it and enjoyed it, and that's what he is pursuing. So can you tell me, is there really certification needed as a biller? Like For others, looking for billers, they don't really require certification, but as long as you have the experience, correct?
Yes, but my I've been my recent or my previous what do you call this employer, she studied medical billing in US. I think in US with medical billing in there they have a course or you must have a certificate in medical billing. But
Mm.
us here in the Philippines, as long as you are willing to learn, you have the experience. Actually, if you wanted to become a medical biller, it's not really you are good in speaking in English because not all the time we communicate with patients. We also um there's nothing if you have a talent or just a little conversation using English, you can be a medical biller.
Yeah, I also like see that a lot of people right now, like we didn't study healthcare virtual assistants in college. We don't know about
Mm-hmm.
medical scribing, billing, and coding, but actually we can actually navigate them through our
Mm-hmm.
roles and try to explore and study more about them on our own, right?
Yes, as long as you are willing to learn,
Yeah.
you have the passion.
So yeah, also additionally, I do these interviews with seasoned virtual assistants like you for our Thrive Freelancing Academy. So like I'm thinking of like having narrow down my mentoring sessions like mentor healthcare virtual assistant because I feel that not all people are really transitioning that fast in the virtual assistant world because
Mm-hmm.
they have corporate roles. They also earn a lot from the employment. But
Mm-hmm.
um, would you still advise people to work from home? That there are a lot of opportunities waiting for them. Um, uh, just having laptop and the the basic skills of being transferring the skills that they learn from other employment. Go ahead.
Yes, of course. Working from home or working remotely for me is a very what do you call this, comfortable or a recommending profession for us, especially when you are living in a city where you will deal with traffics or traveling long hours just to go to your workplace and get back home with your family. I really do recommend working from home or freelancing from
Yeah.
because you will be saving your transportation fees, food as well, mm, food trips or any what do you call this expensive, not
Yeah.
really expensive,
Mm.
but really when it comes to budget, you can really do have a budget. So you will be budget um secured budget if you are working from home because you will only need a laptop and a monthly fee of Wi-Fi.
Yeah. Thank you for sharing. I also want to add that aside from saving money from transpo and food,
Mhm.
we can actually save our energy
Yes,
for the people we love most. And maybe if you're in the ministry, you can also serve more in
yes.
the church.
As- And we can really do save time and a lot more time for our families. Also, if you do have children or small kids, really, it's a big plus or really an advantage.
Mm-mm. Does it mean, Miss Divi, that you're not going back to the hospital as medtech?
As for me, I don't really meant into really pushing a person being to be a medical biller or I not medical biller to work remotely or work from home because we do have our own choice. But for me, I will not return working at the hospital anymore because aside from uh that run. So the fees here in the Philippines, healthcare professionals are being um uh not not well paid. Yes, it's
Right.
an honest review, right?
Yes. And
Uh,
yeah, you were able to experience that yourself.
yes,
Because yes, go ahead.
yeah, and if you work remotely, you will be earning, for me, times three or times four from working in the hospital, I think. And aside from, you will be exposed to several diseases or illnesses or
Mhm.
infections. That's the advantage. Sorry.
Yeah, thank you. I mean, you are convincing me to stay home because I just saw an opening in a nearby hospital here, and I was like wanting to tell my boyfriend, and for sure, my boyfriend will tell me, we are done with that topic already. We're choosing well-being, and and I know I'm blessed with interviews for night shift job, but it also feels really good. I feel relieved when I'm able to say I'd like to politely decline, but I'm choosing a
Mhm,
morning shift. Like we also have Australian Miss Divee, if you wanna try applying in a morning, client.
mhm.
I hope you can consider that too because well, our
Yeah.
well-being, mental health really needs sleep. So yeah,
Yes.
I can
And
refer you to our agency
that's
if you
the
like.
advantage, disadvantage of working night shift or graveyard shifts. Because I cannot say work from home is completely perfect profession or a perfect thing to be with, to be in, because when I first started with my as a medical biller, I do have this anxieties
Mm.
attacks because you were new to the environment. You were working all along
Yeah,
night. You don't have
you're
anyone
isolated.
to talk
Yeah,
to. Yes, really. It's a process of mental
yeah, yeah,
issues being in this profession.
yeah. But I'm happy you have your partner with you. But maybe sometimes he's
Mhm.
sleeping already,
Yes.
and you can have him to talk to during work time. Okay. So thank you for sharing about the advantages and disadvantages of
Mhm.
being a healthcare virtual
But
assistant.
mhm.
Um, yeah, it's about choice. It's about
Yes, it's about.
really thinking about what do you want to do for the rest of your life. Would it be
Mm-hmm.
working for a 9 to 5, like that's really
Mm-hmm.
stressful, or not giving you the freedom or more time with family, right? But yeah,
Yes.
I like that you told me that we respect people's choices. We just
Mhm.
suggest, but we don't insist. Okay,
Yes,
let's
we
go.
do suggest, but we do not insist.
Okay,
We
thank you.
don't want to be
Controlling
like
person, maybe.
yes,
Yeah.
right, or
You all have freedom. Yeah. Okay, let's go back to talking about the billing specialist role you had. Number three question: how do you stay updated on changes in medical coding regulations and payer policies?
as for us, previously with my employers, we I think they were subscribing to APC and CMS rather, so newsletter. So and if they were able to subscribe it, they were up they were updated by the coding updates or the new regulations when it comes to billing and coding. So they were gonna forward it to us or email us that way so we could if we do have time we can read it or refresh our mind with those policies and regulations.
Mhm. That's good to hear, no? So let's
Mm-hmm.
go number four question. Describe a time you encountered a complex billing issue. What was the problem? How did you approach it? And what was the outcome?
Mm-hmm. In our specialization, we are in OBGYN we specializes in OBGYN. So when it comes to um, denied claims, right, or complex claims,
Yes.
um it's normal to we are being denied for the reason of it is not included in a coverage or
Mm,
in a patient plan. But
mhm,
we always do further investigation, review what we had encoded or the dates we are in encoded in the HECFA or in the form in the claims. So in a global in I think in the global package, I think in the duration of pregnancy, there were what do you call this, prenatal visits.
mhm,
So some of those were being denied because some insurances were denied because it was being submitted past timely, but it is not a past timely submission because it is included. We build it during the entire pregnancy period of the patient.
mhm. Okay, thank you. I'm having like an overview of the OBGYN practices.
Mhm.
I just want to ask because I remembered we are having challenges with collecting outstanding balances of patients. So the doctor decided to just set an amount that they could
Mhm.
pay upfront and then just
Mhm.
return back or like add in their
After.
succeeding follow
Mhm.
up the change from there. For example,
Mhm.
$250. Is that advisable, or did you also do that in your practice?
For us, I was also assigned into patient payment collections. We before the date of service or the time of service, so we really do email patients or send a messages when it comes to their
Mm,
estimated payments or estimated value of that procedures. If we already sent it, patient will inquire or patient will come if they could have what a discount or a small
mm,
balance to pay just to be seen by the doctor.
yeah.
So we
Mm,
always opt to, if they can fully pay it fully, it would be great. But you can they can pay it in half, or if they can't afford also a half, we can do it divided into four, or
installment.
yes, or we can pay with just a collect a minimum of $50 before the
$50.
time of service.
Okay.
Also,
Mm-hmm.
we offer the payment plan options, but we strictly the we strictly come up with a 12 months only payment plan because my new RCM supervisor previously uh she don't want anymore to get the payment plans longer than 2 years to 3 years.
Mm-mm, yes, very long, right? So thank you
Mm-mm.
for sharing. Also, I want to bring up this dilemma. Like when verifying insurances, I'm not sure if that's part also of your role. Um, Sometimes the patient would say that they're done with the deductible, and then when we call the insurance company, they said there's still deductible left.
Mhm.
Um, what do you do when there's like disconnect with what the patient says and what the insurance says? Is it part of your
Impatient.
role, insurance verification?
I haven't been into patient verification
Ah,
processes, and they don't have any experience by that. But with eligibility
yeah,
checking, or if
eligibility.
the patient is eligible with the insurance, we do have in Athena Health. There's a portion where you can automatically check the eligibility of the patient, our patient in there. So, if it is not verified, what we can do, let the patient talk to her insurance why she is
Mm,
not eligible at the moment. But as for us, we just say to the patient that she will be calling the insurance, and not on our end. We do not
mm.
really do that one.
Oh wow. So the patient do that themselves and
Mhm.
your
We really
practice.
advise patient to call their insurance.
Nice, nice. Okay.
And just give us a call back.
So you can schedule them for an appointment,
Yes.
correct? Okay. So last question here. In your opinion, what are the most critical qualities or skills a medical billing specialist needs to possess to be successful in this role?
Mm, as for me, the one I think is being attention to detail. It is a
Mm-mm.
very important role of being a medical biller because if you do miss any informations, just like you interchange male into female, a claim will be
Mm-mm.
denied, um, and misspelled names of the patient, or yes, you really have to be attentive into details because it is like one of the crucial roles in medical billing. And
Mm-mm.
we do not want to get a claim denied and reprocess it again and again.
Yeah, yeah. Repetition, yeah.
Also, you should have to adopt or the ability to adopt easily.
Quickly. Yeah,
Yeah,
very,
yeah.
it's very fast-paced industry, right?
Yes.
Even we're working remotely already, they
Mm-hmm.
still need that we have deadlines, they need reports
Mm-hmm.
right away. Yeah. So yeah, there's like two options, I believe. Medical billers working for 8 hours with the practice and also doing the medical billing on our own pace. Is that true? Like once we get certified, we can be doing the work on our own pace. Is that have you heard about that? Like for billers in the US, like they just collect maybe receipts to, balance everything to see how mm, to how to help the
Mm-hmm.
practice have revenue. Were you able
I
to?
think so because I think some of our coworkers who onshore billers and they're just doing that. But for us in our company, we do not practice that things like that. I on my end, I think we do not do that
Mhm.
one.
Yeah, you work with the client 8 hours, right?
Hmm.
What
Yes,
what time zones or country are you serving?
Arizona. And I am working 11 a.m. to 7:30. We do have a 30-minute break.
Oh, 30, not 1 hour. Okay. Later you'll be
Right.
working, correct?
No, I don't have work right
Uh,
now. I'm looking for another employer.
oh. Okay, we'll be praying for your next employer, Miss TV. So, um, for last tips, as for healthcare VAs wanting to upskill as a medical biller, what can you tell them?
Um, I think we for the other virtual assistants, right? Wanted to upskill into medical biller. Is that the question you were
Yes,
referring to, ma'am?
yes.
Uh, I wanted to say to them that medical biller is a great profession because if you uh went to a employer which has the you were assigned in air or aging claims, you don't have to do the inbound calls and outbound calls.
You like the admin task, okay.
Yes, and it's nice because you can everyone, even if you are a high school graduate, but you are a computer literate, you can easily understand medical billing processes as long as you have the passion or the persistent, that you are a persistent person to learn the idea of being of how to be or how to be a medical biller. You can do it. A medical biller is not really a profession you a difficult profession or difficult work.
Mhm. So thank you so much, Miss TV. And so for our viewers, who are ready to kickstart their VA journey. If you're eager to transition into the virtual assistant world, our Thrive Freelancing Academy is here to help. We'll work together through personalized mentoring session, a professional CV revamp in Canva, optimizing your profiles in LinkedIn, JobStreet, and Indeed, and tips and key strategies to land your first client. Please send me a message to get started. And Ms. Divee, it was a pleasure having you tonight. Thank you so much for your time and for sharing your valuable insights with our aspiring VAs. We really appreciate it. That's all for today, Thrivers. If you found this helpful, give it a thumbs up, subscribe for more VA insights, and hit that notification bell so you don't miss a thing. Thank you so much, Ms. Divee. Have a
Thank
good
you and
night.
have a great day.
All the best with your job search. And thank you again. And I'll see you everyone next time. Bye, Miss Davy.
Bye.